Hi, I'm Steve Nichols from Adelaide, Australia, and welcome to EHJ Today. We're here at the ESC 2014 for another lively discussion about another hotline trial that's been presented at the meeting here this year. I'm joined by Dr. Massimo Amasio from Torino and Dr. Tommaso Gori from Mainz, and we're here to talk about the COPPS-2 study. So Dr. Amasio, tell us what is COPPS-2?
COPPS-2 is a multi-center double-blind randomized trial to assess the efficacy and safety of colchicine for the prevention of several post-operative complications, including the post-pericardiotomy syndrome, post-operative atrial fibrillation, and post-operative effusion.
Right, and the rationale for doing COPPS-2?
Yes, the background of the study is the COPPS-1 trial that was an outline trial presented in 2010 in Stockholm at the European Congress of Cardiology. And in this study, colchicine, that was also a multi-center double-blind randomized trials, colchicine was given starting from post-operative day 3 for 1 month. And it was efficacious for the prevention of the post-pericardiotomy syndrome, post-operative atrial fibrillation, and post-operative effusion. The rationale for doing a second trial is that the maximal incidence of post-operative atrial fibrillations is in the first post-operative days from 1 to 3. And so we speculated that probably the early administration of the drug before surgery, so as a pre-treatment, could even could probably increase the efficacy of colchicine to prevent the post-operative atrial fibrillation. And that's why we planned the COPPS-2 trials, where colchicine was given 2 to 3 days before cardiac surgery instead than after, such as in the COPPS-1.
Right, and this was a multi-center trial. Where was the study conducted?
Yes, it is an Italian multi-center study. It is a spontaneous study within the Italian national healthcare system involving 11 centers in Italy. And we enrolled 360 patients, and the study was powered to test the study hypothesis that colchicine could have the incidence of the post-pericardiotomy syndrome and have similar effects also on post-operative atrial fibrillation and post-operative effusion.
Right, so what did you find?
Well, we confirmed that colchicine is efficacious for the prevention of the post-pericardiotomy syndrome. We recorded an absolute reduction of 10% in the incidence of the post-pericardiotomy syndrome. But despite the very good promise of the COPPS-1 results, we were not able to confirm the efficacy of colchicine to prevent the post-operative atrial fibrillation because of the higher rate of side effects, not severe side effects, but especially gastrointestinal intolerance in colchicine-treated patients. And the reason for this probably is the interaction with colchicine with other drugs that are commonly prescribed in the perioperative phase, including proton pump inhibitors and antibiotics that may also predispose the patient to gastrointestinal intolerance.
Okay. Tommaso, what's your take on this?
Well, I found it was a great study. It was very well planned, very well run. It is actually, to say it very shortly, it is a study that will definitely make the guidelines. So my compliments. It's really interesting. There are several reasons. It is clinically relevant. It is a small intervention with relatively little side effects and some, not nice side effects, but not dangerous ones. Now, the discussant, you presented your study. The discussant was my colleague Stavros Konstantinidis from Mainz. He was quite aggressive in his discussion of the findings. There were 2 studies today presented, and the previous one was also with colchicine. The Post-2 study was also with colchicine in the same setting of patients, and it was about the prevention of pericardial effusion alone. Now, the one thing that you have to convince me about as a non-surgeon, I'm an interventional cardiologist, so I tend to send as little patients as possible to surgeons. But still, the one thing that you have to convince me about is what is really dangerous about a little bit of pericarditis after a surgery.
Yes, good point. Well, if we consider the COPPS-2 trials and the outcome of the patient who had the post-pericardiotomy syndrome, the outcome was rather good. So overall, considering the side effects, we have to say that according to the findings of the COPPS-2, I would not recommend to use colchicine perioperatively at the doses of the COPPS-2 trial to prevent the post-pericardiotomy syndrome, because the outcome is quite good. So probably in this case, an early treatment, an early recognition of the syndrome, and an early treatment also with colchicine, as demonstrated in other clinical trials, may be probably better tolerated by the patients.
Sorry, you will start then colchicine after the...
according to the results of the COPPS-2, I would recommend more early treatment, early recognition of the syndrome, and early treatment instead of the preventive use of the drug. If you see at the results, however, you can see a clear trend toward the reduction of postoperative atrial fibrillation. In the pre-specified on-treatment analysis, that is, patient who tolerated the drug, colchicine prevented the postoperative atrial fibrillation. So I think that probably the drug can be efficacious for the prevention of postoperative atrial fibrillation. The problem is the dosing. So probably we need additional studies to test the lower doses, maybe only 0.5 milligram once daily for all patients, and maybe also with a running phase, because if the patient tolerates the drug, we are for the second time evidence that it could prevent the postoperative atrial fibrillation. So I think there is space for additional investigation. I know that there are a couple of trials in North America that are going to start and probably take advantage of the results of the COPPS-2 to adjust the dosing of colchicine.
Let me draw you out on the atrial fibrillation a little bit more. Clearly, a lot of our patients who go for cardiac surgery, post-operative AF is a common complication we see. You know, we see a lot of these types of studies, and it's challenging to see interventions kind of reduce the incidence. Do we think inflammation's driving all of this? Is that why we think colchicine may have an impact there?
Well, yes. If we look at the results of the COPP-1, we saw a prevention of several complications that are linked together by systemic inflammation, post-pericardiotomy syndrome, postoperative fibrillation, postoperative effusion. And we have evidence also from the results of the COPPS-2 trial, because in the subgroup analysis of the trial that has been published online on the Journal of the American Medical Association, there is a figure online only available about the subgroup analysis. And in this subgroup analysis, you can see that the colchicine was efficacious only in the subgroup of patients with elevation of C-reactive protein. So this is a clear evidence that the drug is efficacious only in the setting of inflammation. If you have systemic inflammation, the drug has some space to act. And so probably I think we need additional studies with the correction of the doses and the times. Maybe the drug could be even efficacious. At present, I would not recommend the use of the drug at the doses used in the COPPS-2 trial.
Okay, I mean, one of the things I really like about this trial is it's an investigator-initiated study which builds upon an earlier investigator-initiated study. They're asking clinically relevant questions. In the first study, you asked a question, you got an answer. You wanted to extend the question into the kind of pre-operative space. And it really demonstrates, I think, the power of investigators coming together to really answer important clinical questions. So on that note, Tommaso, take-home message?
I totally agree with you. It's much more research than a lot of trials that we see presented at the time. So really compliments from my side. It's really your interest, and this is what you designed.
Really to thank all the investigators, because it was a spontaneous study, so the participation was free, and so all the investigators, also the validation committees that were working for free because it was a spontaneous study, and also all the physicians and patients who decided to.
Isn't that today there still is research.
It really is important to see. So take-home message.
Well, it's a very interesting study. It's a very important study. The intervention that you studied is a low risk, low side effects, obnoxious side effects, but not dangerous ones. So it's very important to study it further. Yeah, and I will use colchicine in my pericarditis patients for sure.
And final comment?
Well, I think that the study adds new evidence supporting the use of colchicine, especially in the setting of inflammation, systemic inflammation. And so the drug is quite efficacious for the treatment and prevention of pericarditis. If you have a patient with pericarditis, even post-cardiac pericarditis, you should consider the drug. We should better understand the better dosing and the better time of administration of the drug, because we have consistent evidence that probably the drug could be efficacious for the treatment of several inflammatory post-operative complications, but we need additional studies on this.
Great. Well, thanks for joining me today, and thanks for joining us on EHJ Today, the voice of leaders.